How to get rid of pimple in ear. We suffer enough because of the pimples on our face. But, what if this unsightly and annoying bump crops up on the ear, or worse, inside the ear? Keep reading to know more about how these pimples form, why they form, and how you can get rid of them easily. Pimples on the ear can emerge on any part of the external ear, behind the ear, and even inside your ear canal. A pimple or acne is a common skin disease that occurs because of excess secretion of oil, sebum, from the skin's oil glands. The ear pimples, otherwise called as ear zits or ear bumps, are medically called as sebaceous cysts. The excess oil traps the dead skin cells present on the outer skin surface and blocks the pores of your skin. It also traps the bacteria and fungi present in the vicinity. As a result of this, a bump or a pimple is formed, which can or cannot contain pus. Blood can also be present in a pimple, leading to a bloody discharge from the ear. What causes pimples in the ear? A pimple or zit in the ear can become uncomfortable and can also cause obstruction in hearing. This is especially the case when the pimple forms in the ear canal, where it can become very painful as well. Usually, the pimples that form on the outer ear are painless. Let's have a look at some of the most common causes for an ear pimple. Otitis externa, commonly called as swimmer's ear. This ailment can occur due to swimming in unclean water. The bacteria present in the water cause infection of the outer ear and in the ear canal. Other reasons for this include scratching the ear with unclean objects or getting a tiny object stuck inside the ear. 4. Infection due to piercing. Irritation caused due to piercings can lead to the formation of a small bump on the earlobe or in the ear canal, next to the piercing. The dirt, wax, and oil are major components of this. This bump that has formed can develop into a pimple or a boil, and can also become painful. Poor hygiene. The ear canal is sensitive and should not be poked with pins, toothpicks, or any sharp objects. This can lead to infections. Also, unwashed hands, dirty earphones, and unwashed hair can introduce harmful bacteria to the ear. Here, they grow and cause pimples. Irritation from the earphone's material can also cause bumps in the ear. Hormonal changes. Changes in the hormones levels in the body can also result in the formation of ear zits, especially in women. Keloid bump. A bump of fibrous tissue is formed at the site of injury and looks like a scar. This is called a keloid and is usually seen near ear piercings. Medical advice is recommended for their treatment and removal. Other causes. Chronic conditions such as cancer can also be responsible for the formation of pimples and bumps in the ear. The cancerous cells can be malignant or benign. Please consult your doctor if the bump in your ear does not heal in a week or so, and looks different from a normal pimple. How to get rid of pimple in ear. Ear pimples usually heal and disappear by themselves within a week or so. If you wish to fasten this process, you can use one of many methods listed below. Always remember to wash your hands thoroughly with antiseptic liquid before touching the ear pimple. Unclean hands can cause the infection to develop further. Read on to know how you can easily get rid of a pimple in the ear. Method A. Get rid of pimples medicinally. 1. Rubbing alcohol. You will need rubbing alcohol cotton swab. What you have to do: dip the swab in the alcohol and gently clean your ear and surrounding areas, especially near the pimple. When you need to do this, clean with alcohol twice a day. Why this works: alcohol acts an antiseptic agent and prevents the spread of the infection. 8. Caution: do not put too much pressure on the pimple. 2. Witch hazel. Witch hazel. You will need witch hazel cotton ball or swab. What you have to do: dip the cotton ball in witch hazel and remove the excess solution. Apply this gently on the pimple and surrounding areas. When you need to do this, repeat this twice a day. Why this works: witch hazel has antimicrobial properties and helps in treating the infection that has caused the pimple. 3. Hydrogen peroxide. You will need hydrogen peroxide cotton ball. What you have to do: soak the cotton ball in hydrogen peroxide for a minute. Remove and squeeze out the excess solution. Dab the cotton ball over the pimple a couple of times. When you need to do this, apply hydrogen peroxide to the pimple a few times a day. Why this works: hydrogen peroxide not only kills the bacteria but also fastens the process of getting rid of the pimple. It has both anti-inflammatory anti-inflammatory and antibacterial properties. For Neosporin, you will need Neosporin gel. What you have to do: apply the gel on the pimple and let it dry. When you need to do this 2 to 3 times a day. Why this works: Neosporin helps in treating the infection and also drying up the pimple, as a result of which it heals faster. 5. Acne cream, you will need acne cream containing 2 to 10% benzoyl peroxide. What you have to do: apply the cream on the affected area and let it be. When you need to do this 2 to thrice a day. Why this works: the benzoyl peroxide present in the acne cream is an antiseptic agent and kills the bacteria causing the infection. Acne creams also contain other components that help in quick healing of the pimple.